Exercise has consistently been shown to reduce cancer incidence, reduce risk of cancer recurrence, and reduce the risk of cancer progression. But how? My name's Dr. Morgan Farley, and I'm the founder of Valere Health. And this is a study from my thesis where I explored one of the mechanisms thought to be involved in the suppression of cancer growth. So, exercise has consistently been shown to be able to suppress cancer growth. Here we have images from a preclinical model where you can see the black spots are cancer, and then you can see the tumours excised from the exercised mice, where there's a significant reduction in the amount of cancer growth. But how? It is thought that every bout of exercise we do matters and accumulates over time to cause this suppression of cancer growth. With each bout of targeted exercise that we do, we get these spikes through these pink humps of exercise factors that over time contribute together to reduce cancer risk and risk of recurrence and help improve outcomes. So there's been both in vitro models where we've taken blood immediately post-exercise, put it on cancer cell lines, and it significantly reduced cancer growth in breast, prostate, colorectal, and lung cancer models. Likewise, exercise has been shown to suppress cancer growth in these preclinical murine models. But how? It is thought that a key mechanism, at least in part, behind the anti-oncogenic effect of exercise is these myokines like IL-15 and IL-6. And to support this further, and this is a really interesting study where they showed that mice that exercised with pancreatic cancer were more responsive to immunotherapy than those mice that just got the immunotherapy. And the mechanism behind this was this exercise-induced IL-15. However, the IL-15 response is yet to be explored in human cancer survivors. So this is what my chapter of my thesis led to do. We did a high-intensity interval cycling session that basically aimed over time to increase the heart rate and then bouts of recovery to reduce the heart rate. And we did that 4 times throughout the session. We took blood immediately before and then immediately after this exercise bout. And we measured it for these myokines, or these factors that have been shown to suppress cancer growth in these in vitro and preclinical models. And we saw across the board in these factors a 50 to nearly 100% increase. But more importantly, in IL-15, we saw a 96% increase in circulating IL-15, one of the factors shown to be responsible for this improved responsiveness to immunotherapy. And this response was associated with more muscle mass. So what does this mean for those of you who are listening that either work with people with cancer or you're aiming to reduce your risk of developing cancer coming back, or the spread of cancer? Well, it's that knowing that exercise and targeted bouts of exercise that get your heart rate up, so get you feeling a little bit breathless, are going to do wonders in terms of potentially reducing your cancer growth and improving some outcomes. While I can't promise exercise is going to do that, it certainly is going to move the needle in the right direction. And so what is this exercise? Well, it's things like dancing, things like hill walking, bike intervals, jogging on the spot, anything that's going to get you a little bit breathless so you cannot speak in sentences, then a period of recovery. And then you repeat these a couple of times. Now, the other important factor that we found through this study is that we want to also complement these higher intensity bouts with exercise that's going to build muscle. Still not sure where to start? Come and join us at Valere Health, where we use evidence and research to inform our practice and individualize it for you. And I can also promise you'll leave with a smile on your face.